Okay, we're back, but this time we are with Dr. Howard, who is the clinical psychologist with Grazel Garcia Psychotherapy and Associates. How are you today, Dr. Howard?
I'm doing well, thank you.
Good. Good, good. So, you head up the Neuropsychological Testing Department at GGPA. What is neuropsychological testing?
Neuropsychological testing is a process where someone gets a battery of testing done to hopefully find out more information that they had previously with regards to their symptoms, to their brain function, to their learning abilities. So it's a comprehensive set of tests that um, help to evaluate someone's psychological cognitive profile.
Okay. And what sort of outcomes are, like, for example, if someone suspected they have ADHD or autism or anything else, is that the sort of thing they'd come to you for?
Certainly, definitely some common reasons why folks might seek out neuropsychological testing. Either they previously received diagnoses of attention deficit hyperactivity disorder or autism spectrum disorder, or other specific learning disabilities or differences. They may have never received an official diagnosis, but always had suspicion that had they their brain functioned differently, and or that they struggled in certain areas of school or daily life or their job that they never fully could explain. And so they're seeking some clarity in terms of maybe a diagnosis or confirmation of a diagnosis. Um, Another common reason why someone might seek out testing is to to qualify for certain community or occupational or educational resources, like accommodations,
Mhm.
um, in light of their cognitive um, differences. They may need certain resources or certain adjustments to optimize their functioning. So some most institutions require a certain degree of neuropsychological assessment with certain tests that have been um, sort of considered valid and reliable and can substantiate a diagnosis and one's disability, so they can qualify for the resources they need. Um, yeah.
Yeah. So someone thinks there's something going on with them. They come to they come to you for some neuropsych testing, and as a result of that, they might qualify for some additional support to help them with whatever they're kind of experiencing. Is that a good summary?
Absolutely, yes. And this can include children very early, even pre school years,
Mhm.
um, youth all through school, young adults, perhaps young adults pursuing higher degrees of education or certain professional examinations and requirements, and they they would perform more optimally if they had certain resources and accommodations. And so, neuropsychological assessment is an essential step in that process of acquiring those resources.
Got it. Okay. Um, so you mentioned a little while ago that it's a battery of tests, which sounds quite intensive. So what's the
Yes,
experience like from the client's side?
it's a great question. There's many different conceptions of what it means to get tested or evaluated. A battery of tests really just means a collection of multiple tests of different measures, different types of tests. Many of these tests involve filling out questionnaires, so nothing too intensive. Um, some tests have multiple tasks that a client is asked to perform, and they usually some of which are pretty simple and straightforward and easy to establish a baseline, and some get progressively more difficult. And yeah, so some folks might find it kind of mundane, kind of simple and straightforward, and perhaps even boring. Some folks might find it enjoyable and especially considering that this is not how they usually are sort of evaluated in a clinician's office. Oftentimes that just looks like a clinical interview, just questions and conversation like this. This is more of an objective approach to gather some straightforward answers and some concrete data on someone's functioning. And it could feel high pressured in that a client might come in, especially if they have certain reasons for the testing, such as getting a confirmation of a diagnosis, or ruling out a diagnosis, or something that they just have other sort of concerns about that might implicate their access to things, or the way they're perceived. So because of that, there might be some pressure to perform extra well. Some might want to be careful not to perform too well. But these tests are designed in a way to capture pretty accurate and honest and genuine responses, and filter out the rest. And so they're designed already to kind of capture an objective picture in this single time and place, so to speak. Having said that, someone might come in middle of the week during their work week, and their work is very highly demanding and stressful, and they haven't really eaten that day, or it is important to kind of capture someone in their naturalistic settings, but there's a number of factors that can impact how someone responds or performs on certain tests. And this is carefully considered when collecting this data and interpreting the results. So nothing is perfectly accurate or objective, but these tests, the tests involved in neuropsychological battery of assessment, is meant to try to objectify things that aren't so objective, so to speak. So it's a different angle than the usual subjective angle that we are used to. Yeah.
Yeah, and that's really
Did that
interesting. Go on.
kind of come across clear?
No, yeah, that's great. Thank you. Yeah, I love the detail because this is something that I know literally nothing about, and I imagine a lot of people who are watching this are like, maybe I need to get tested, but what does that actually look like on the ground? I've got no idea. Do I even want to go through with this? So yeah, that's great. Thank you. The, so you talked about getting this kind of objective assessment. So you go through all
Mhm.
these tests, you fill out all these questionnaires, and then you obviously compile all that data, and then you give them a diagnosis. And the downside of that, I guess, is that you get labeled with something, and labels can feel pretty bad sometimes. So how do you kind of make sense of those results, or help the client make sense of their results in a way that really empowers them?
Yeah. Well, it varies widely and wildly. Some folks may be really looking for that diagnosis or label to explain their struggles that they experience, but don't understand, or aren't sure are even quite valid, or if there is an explanation for them. So sometimes it can be quite comforting to go, you there there is a pattern in the results. It does um, it sort of lines up with certain known conditions or disabilities, and there are specific treatments and resources that can help with those specific conditions. And so sometimes that can feel quite comforting and validating. However, um, yeah, there's a lot of stigma and bias that comes with mental health, medical diagnoses, and just implications of getting these diagnoses. I would say that a lot of folks come in concerned about receiving official diagnoses. And so I find myself having to sort of explain what getting officially diagnosed means. So you can meet with a clinician, a health care provider, and talk about your symptoms, and they might um, come away with that with a suspected diagnosis. Um, that might go into their medical record, and that to some degree is official and that it's in record, but some folks may have a number of different diagnoses in their health records, and they can't all be true or entirely true, and that it can further confuse one uh, in understanding what they are dealing with. So sometimes folks come in to go, what do I not have? What's the sort of holistic picture, and what might be the, if I do have a diagnosis, what might be the primary cause, primary sort of explanation for what my struggles have been? And so that can be a very uh, useful sort of purpose to assessments, to rule out and to better clarify what might be going on clinically. I also stress the fact that after all the testing is done and we collect all this data, including history and just their personal reports, I take all this data in, I take a look at them as a whole person, and I come up with possible interpretations and diagnostic considerations. And I title it as such instead of your final and conclusive and official diagnoses are. Not at all. It is in light of this data and based on my expert professional opinion, the evidence supports these diagnoses and not these, or it doesn't meet criteria for any diagnoses, at least that exist currently in the DSM. So whether they come up with a number of considerations or the considerations are ruled out, they want to take it with a grain of salt. They want to see it as further support for sort of an ongoing hypothesis. They get to have some say as to what's official or not. Having said all that, some folks are required to come get testing for accommodations or for litigation or disability claims. And those purposes require this kind of evidence provided in a neuropsychological assessment to substantiate enough a disability or diagnosis. And so that might feel much more official, but it is official for those purposes. But again, in terms of feeling labeled or boxed into a category, I make a point to educate clients on how they can relate to diagnoses in a way that feels supportive and right to them.
Yeah, so it sounds a little bit like you're making a distinction between the diagnosis and the person's identity. Is it right to have that kind of distinction?
Absolutely. I think that's a great way to put it. Um, Instead of being defined by a diagnosis or diagnoses, it's a way to categorize a set of symptoms that they may experience. Sometimes diagnoses can point to an underlying cause, but oftentimes they're used as a way to speak about and conceptualize a set of symptoms and certain patterns. And again, this is all based on what's been researched, what these testing instruments have been used and studied with, what kinds of populations. Um, um, the same sort of scrutiny goes into developing diagnoses in the Diagnostic Statistical Manual. This is ever evolving, and I make a point to explain that too, where you might have a number of different patterns and conditions that some of which fit nicely into a diagnostic picture and others not so much, but just wait until the next couple editions of the DSM and you might find something that fits a lot more because it's the diagnoses that are being refined and modified and evolved to fit what we're seeing in reality and seeing in individuals as opposed to the other way around.
Yeah, that makes sense. And I guess my final question is, I'm just sort of putting myself in the shoes of someone who maybe has these kind of struggles, and maybe they're in school and they've been going down a particular path in terms of their education and how teachers have been treating them and accommodating them, or maybe it's the same in the workplace, or maybe they're in therapy and therapy's been going in a particular direction, and then they come for an assessment and they suddenly get hit by a diagnosis or diagnoses. How can that shift things? Can that have quite a big impact in terms of that direction that they were heading in?
It can, but hopefully it does for the better. Um, the reports that come out of the neuropsychological assessment process include a sort of collection of all the data, a summary of the data, and an interpretation of the results, diagnostic considerations, and lastly, a set of recommendations in light of that evidence, in light of those considerations. If one is already seeking treatment, they may receive some more specific treatment recommendations or interventions that can sort of progress their treatment further along. It might also answer certain areas of confusion in terms of perhaps why they're plateauing in treatment or why they've been in it for a while and they're not getting anywhere, and gaining some more insight into their experience might shift treatment course altogether towards a completely different diagnosis. So neuropsychological assessment is a useful tool and it should be used as such. And this is ultimately their protected health data to be taken with a grain of salt, but can be taken to their therapists, their treatment providers, to other professionals to get additional opinions or to help inform how treatment should go. So nothing should come out of a neuropsychological assessment that completely changes everything, in that this individual's probably gone about trying to answer these questions already for some time in various ways, but it does offer this objective angle that is difficult to obtain elsewhere. And so it just might clarify certain questions uh, that that really kind of pivot one's course in just the right way. And so that can feel substantial, certainly. I'll add one more thing too. Folks who perhaps have been undiagnosed or undertreated for certain conditions just because of their access or opportunities to get evaluated, getting a neuropsychological report that provides these diagnostic considerations and qualifies them for certain resources or accommodations can be life-changing. Certainly, it feels like finally their struggles have been answered and they're finally getting supported in a way that that allows them to pursue their goals and reach their potential.
Yeah, and in a sense, it kind of it validates their personal experience of their whole life up to that point. It's like, ah, that's why. Yeah,
Mhm. Absolutely, absolutely. And so it really depends on who's sitting in front of me and where they're coming from and what they know or what they've been told. But try to provide them as much um, information, education, and I really want to support them in learning how to advocate for themselves and to know their rights, to know what's out there, to understand the means to accessing what they need. Uh, so that's the ultimate goal.
that's great.
Mhm.
Well, thank you so much for your time, Doctor. That was so interesting. I'd love to speak to you again at some point.
Yeah,
Um,
I'd like to.
yeah, but yeah, hope you have a great rest of your day. I'll see you soon.
Thank you. Thank you very much. Okay. Bye, Scott.